Hello, everyone. This is Rochelle Seeger. I'm with the Foundation for a Healthy Kentucky. I'm thrilled you're joining us here today on this Health for a Change webinar. The Foundation for Healthy Kentucky was founded in 2001 with the mission to address the unmet health needs of Kentuckians. And the photo on the screen today of that field of flowers is one I took last summer at Need More Acres Farm. The Foundation for Healthy Kentucky's mission is completed by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. I'm so glad you could join us here today. The Foundation for Healthy Kentucky's website, healthy-ky.org, has a lot of information about the foundation and its current focus areas. You can also sign up to join the Foundation for a Healthy Kentucky's e-newsletter. You can see the current news releases from the Foundation, and also find the information about our research and reports, which include the Kentucky Health Issues Poll. In the Foundation's bylaws, the Foundation called for a council, an advisory council, to maintain diverse membership, have broad community access, and consumer representation to inform the work of the Foundation. So I wanted to let everyone on the call know that the Foundation welcomes nominations for the Community Advisory Council. We welcome people living in Kentucky. Seats from the area development districts of Buffalo Trace, Fiveco, Gateway, and Cumberland Valley. We're also looking for individuals who bring racial and ethnic diversity to the council, and individuals with experience from underserved communities, such as folks who are in Appalachia or Delta regions, in rural areas of Kentucky, and also representing folks that maybe have direct experience being served by Kentucky Medicaid. You can find all the details about the Community Advisory Council, the nominations form, and nominations information on how to submit one on our website, healthy-ky.org. Another initiative of the Foundation for Healthy Kentucky is the Coalition for Smoke-Free Tomorrow. Please feel free to check out all of the work that the Coalition for a Smoke-Free Tomorrow is doing at smokefreetomorrow.org. Also on their website, you can join their e-newsletter list there as well. A little bit about today's webinar. Reminders that in the audience chat section, you can send the presenters questions directly if you're logged into the computer side of things. I'll send out information here in just a moment about connecting to the audio. So if you're having any problems with the audio, you can call in via phone and listen that way. I'll send you a message about that. Also, a reminder that this webinar is being recorded, and so the recording of today's webinar and all of the slides will be available to you in a day or so you can share those with your colleagues or review. The full archive of this training series we call Health for a Change is also on the Foundation's website, healthy-ky.org, under the Events tab and Health for a Change. This Health for a Change training series has been comprised of in-person workshops and webinars just like this to support the work that people like you on the call, health department folks, people from the community, to support them in the work that they're doing to improve the health of Kentuckians. So again, my name is Rochelle Seeger, honored to be working here at the Foundation, and I welcome your ideas, topics. If you want to recommend a speaker for this series, I welcome it, so please feel free to contact me there. To upcoming events in July and August, we have on Monday, we'll be talking with Savon Edwards, who does a lot of training in capacity building with nonprofits across Kentucky. So I'm thrilled to talk with her on what's happening in her community, what's happening, how she's responding to COVID-19, and some of the work that she's done on capacity building. And then on August 4th, we'll be talking about health systems and how they can respond to COVID-19, talking with some folks from the Center for Women and Families and Greenhouse 17 from Lexington. Please join us for those events. The Health for a Change series is all about partnerships, so I'm honored to have worked with a lot of different partners across Kentucky, including University of Kentucky Center for Smoke-Free Policy, Kane Community Kitchen, who you heard from recently in Whitesburg, Kentucky, Kentucky African Americans Against Cancer, Louisville Free Public Library, Kentucky Injury Prevention Research Center, and some great workshops with Jessica Bellamy that we did on data equity and data visualizations. And Jessica's new effort is called the Root Causes Research Center, so you can check out her work there. Also, we worked with Kentucky Nonprofit Network on outreach for the 2020 census. So I want to take one moment, Kentucky communities, if you haven't completed the census or you have neighbors who have not completed the U.S. 2020 census, please contact me. I can get you the information. We're still working hard to make sure all of our Kentucky communities are counted. And at this time, people can still complete the U.S. Census for their household on the computer via internet. Later this summer, the U.S. Census Bureau will have workers coming out into the community, so we want to make sure all the Kentucky communities are counted. Health for Change, I'm honored to be here today, and a fantastic community partner. As I mentioned, we were down in Allen County, Kentucky, summer of 2019. Seems like a long time ago, and was glad to be there so I could see in person the work of Michelle Howell and Need More Acres Farm. So I'm thrilled to introduce today Michelle Howell. Welcome, Michelle.
Thank you so much for having me, Rochelle. So what I wanted to do really quick is just start by letting you know that if you would like additional resources on some of the community partners that I work with, or funding sources, or even some recipes that we've used at some of the on-farm events, you can visit needmoreacres.com, and there'll be more information about each of those. And there is also a contact info page on our website if you'd like to follow up with me after the webinar. So what I wanted to do first is I just wanted to start with a story from 2014. I had been invited to speak at the Kentucky Public Health Association conference, and I was prepared to share a story that I've shared several times that I call Keely in Kentucky. It's a story about when I was about 7 years old, and I had recently experienced some childhood trauma. And I was in the school system. I was actually growing up in right outside of San Diego in California. And the kids that were considered at risk would participate in additional activities. So, for example, we would all be gathered from the classroom. We would go and we would work with usually college students on things like simple hygiene, eating healthy food, getting more movement, things like that, similar to programs that we see today. And on this particular day, the young, probably like college dietetic student, I might assume, was talking about a local farm, and she had brought kiwis for all of us to try. And I'll never forget her kneeling down, cutting the kiwi, handing me half of it, giving me a spoon. And as I had that first taste of that kiwi, she said to me, anytime you have the opportunity to eat fresh and healthy food, you should, because you're worth it. And what she had done is she had planted a seed that would later in life become my life work. So at this conference at the Kentucky Public Health Association, the speaker before me was talking about something I had never heard before, and it was ACEs, Adverse Childhood Experiences. And on the table, as she talked about how childhood trauma affects our health, it affects the experiences we have as children, but also as adults, she had a piece of paper and she asked us to take that test, that ACE test, to just kind of get a feel for what she was speaking about. And as I did that, I realized that I scored 9 out of 10. If you score 4 or higher on the ACE test, you have a very high probability of experiencing severe health conditions as an adult and also to carry that trauma on with you. But at the very end of her talk, she talked about resiliency. She talked about ways that we can build resiliency in children and ways that we can help adults who have experienced childhood trauma as well. And what I realized was that when that person had taken the time to kneel down and give me that Keely and told me that I had value, she was planting that resiliency in me. And thankfully, I had family members, neighbors, people throughout my life, teachers, who continue to plant that resiliency. And what that means for me is it means moving forward in our work. So for me as a farmer, moving forward while including all of these parts of myself, including that experience that I had at 7 years old. And the best way I could describe that is hope. And I have a lot of hope for Kentucky, for our future, and for our ability to connect this huge opportunity we have in Kentucky agriculture for fresh food to consumers and to all consumers, no matter their income. A little bit about our family. This is my husband, Nathan, and our 5 children, Carter, Elizabeth, Lila, Adeline, and Sterling. We're full-time farmers, and we stay really busy, as you can just tell by looking at the photo. We grow beef, pork, chicken, and about 100 different fruits and vegetables year-round on our farm. And this is a picture of where it started. So this is in the year 2000. Nathan and I were recent graduates of Western Kentucky University. We had been hired by the University of Kentucky Extension to assist tobacco farmers that were transitioning to fruit and vegetable crops. And so it's 20 years now that Nathan and I have been observing and paying attention to what's happening in Kentucky agriculture. This photo is from 2010. I always like to say that this was the year that was boot camp for our future full-time farming career. We had 4 kids under the age of 6. And we also experienced several life experiences during this time. One was we were participants in the WIC program, and the dietitians and the nurses that were providing me support at the hospital and the health department all were telling me that breast milk was the best first food. And I did not breastfeed my first child for very long, and having been told that and then having the experience of breastfeeding my children, I started to ask myself, what is the next best food? And knowing farmers that grow fresh food, we started to buy more of that food as consumers. The second thing is one of our children experienced severe food sensitivities, which made me start reading labels for the first time and thinking a little bit more about where our food came from. And the third was Nathan and I both lost parents to preventable diseases. And when we lost our parents in that way, we felt more inspired than ever to consider full-time farming. My connection to public health happened also during this time. I wanted to help other moms connect to this experience that I had had about thinking about fresh food, making the decision to breastfeed, and the best way I knew to do that was to reach out to the health department. So I reached out to the Barren River District Health Department and found out that they had a group of professionals that met monthly who had been discussing for a long time about how can we reach more moms in the community. And what really stood out to me is that this was about 2009, 2010, because of the WIC program investing in breastfeeding for moms, because of insurance companies investing in breast pumps and other things that moms needed, because of more lactation consultants in the hospitals, because of pediatricians and OBs suggesting breastfeeding, we were seeing a rise in all income levels. So what I was seeing starting through WIC was helping all moms in Kentucky. And what that really spoke to me was about food in general, food for all of us, and how when we are inclusive of all Kentuckians, all of us get to reap the benefits of that. This was when our very first crop of heirloom tomatoes was grown, and this was how we got our start. We wanted to help make ends meet, pay taxes at the end of the year, and we started growing heirloom tomatoes. And this was when we really got to experience what it was like to be a farmer and be supported by our community. It was also about this time that I had been asked to come and speak at a couple conferences, mainly about my work with local health departments and connecting moms to breastfeeding. But in those conversations, I had started to connect that to my previous story about the kiwi and about also growing the heirloom tomatoes. At two of those conferences, I had women from Kentucky, Janet Mullins and Elaine Russell, come up to me after presentations and tell me that I was onto something. They told me that the work that I was doing was important and that I should keep doing it. And it was their encouragement that built my confidence, built that resiliency even further. In April of 2011, a group of farmers was talking about starting a new kind of farmers market, a farmers market that would, one, really help boost and support small businesses and farmers. It would put farmers in the role of expert, where they were making the decisions that are best for their farms, and also a farmers market that was going to focus on outreach. Community Farmers Market accepts WIC, Senior, SNAP, Big Red Dollars, and also a Fresh RX program that I'll be talking about in just a little while. Another piece of our farm and part of our story is that we, with friends, had grown watermelons as a fundraiser. And when we had more watermelons than we could sell, we had Kim Simpson with the Bowling Green City Schools reach out to us and ask if she could buy them for the start of for when school started back. The following year, we made plans to actually grow watermelons for the Bowling Green City Schools, and this will be our 9th year doing that. In addition, Robin Harrington from Allen County Schools reached out and asked if she could also buy watermelons from us. An important thing about watermelons and farm to school is if you are in a community and you would love to see farm to school happen, late season watermelons are one of the best ways to do that. And there's a couple reasons. One, they're shelf stable. So when we pick them on the farm, they don't necessarily have to be delivered that day, like some of the other crops. The second is they're shelf stable for the school. When the school gets it, they're not getting a product that has to be used that day or the next day. They can hold on for a little bit. The other thing is the students love them. They absolutely love the watermelon. So what you have happening is you have the students, the food service staff, the teachers, seeing the kids respond in such a positive way to the locally grown food. And so I highly encourage, if you're thinking about farm to school, to consider watermelons as the first step. In 2013, Nathan and I made the decision to farm full-time. So this meant that Nathan left his position with the University of Kentucky and some work he was doing for the viticulture program at Western, and all of our income became on farm. And most of our funding at that time, or our income from that time, was from a CSA program and then sales at community farmers markets. But we had also started doing weekly deliveries of food to Hotel Inc., and then also had continued expanding on those watermelon sales to the schools. In 2015, we hosted a farm dinner. It was an elegant, beautiful farm dinner that people came to. It was a fundraiser for Hotel Inc. And it also was a pivotal time on our farm. After that event was over, we started to really ask ourselves questions about the legacy we wanted to leave as farmers. And I personally had to think about what my values were and how could I be inclusive to that 7-year-old girl who had had that experience with the kiwi. I'm very thankful for Diane Sproul, Dennis Cheney, and Chrissy Rowland, who are all at the Bering River District Health Department at the time, who encouraged me in this work and encouraged me in the importance of it. It was about moving forward while including myself. It's very easy to lose ourselves in this work, and we have to be really careful because the very thing we care about, the health of ourselves, our families, our communities, can end up being sacrificed if we don't take that time to stop and really think about the work we're doing. So what Nathan and I really decided at that time is that we wanted to expand the conversation about farming as much as possible. We had at this time about 15 years of active experience, plus Nathan had grown up on a full-time farm. I had also had 7 years of additional agriculture experience before that. And what we noticed happened was a lot of people in Kentucky are kind of in silos about the conversation around local food. The truth is we all need to eat more fruits and vegetables, even farmers, even dietitians, even people who focus on nutrition and health every single day oftentimes struggle with eating enough fruits and vegetables. What can happen sometimes is our conversations can get an inch deep and a mile wide. What I mean by that is sometimes the questions, are you organic or non-organic? Are you small scale or a commodity farmer? Do you sell to a niche customer base, or do you participate in charity or handouts or low income food production? And what we miss is that it's all those things together that build a food system that will feed our communities. This is about long-term growth and more inclusive food systems, and it's hard, and we can only do it with partnerships. Here are some of the partners that we have across Kentucky, and I want to tell you about a little bit about each one, and then also tell you that you can find links to their websites on the Need More Acres website. Community Farm Alliance is one of our partners. They offer support for local farmers markets, for market managers, and for Double Dollars programs for WIC, Senior, and SNAP. And they're also our partner on the Fresh RX for Moms program at Community Farmers Market, which I'll be talking about a little bit more in just a minute. The Kentucky Department of Agriculture has been a longtime supporter of our farm. Our good friend Sharon Spencer is somebody who we've always been able to reach out to and ask questions to, and now new staff all the time coming on there. They provide support for marketing, education, and then we actually have a specialty crop grant. KCARD, the Kentucky Center for Agriculture and Rural Development, has helped us multiple times with feasibility studies, grant writing, and things like that. Great resource if you're trying to connect to other partners in your community. Kentucky State University has a small-scale grant, $5,000 for individuals and $15,000 for co-ops, markets, larger organizations. Community Farmers Market in Bowling Green was able to renovate its facility with the labor of local farmers and customers who came together to do that, and with a $15,000 grant from Kentucky State University. WellCare has been a great supporter. Morgan Kirk and Jennifer Wilson are our contacts on that. They've helped us with funding and also just making sure that our work is as equitable as possible. I know that there's several other insurance companies on the call today, and I would love to reach out to you all and have you be included. The more insurance companies we have involved in this work, the better. United Way has funded several of our projects through Hotel Link that I'll be talking about in just a minute, and they are a great partner. The Foundation for a Healthy Kentucky, of course, had an on-farm event last year and then is hosting me for this webinar today, and we're very thankful for them helping us do that. The Organic Association of Kentucky has hosted a field day at our event and also invites us to speak about equitable food systems at their conference every year. And the Kentucky Public Health Association has been a great resource for me, not just learning about the things that we're focusing on as Kentuckians, but also allowing me to come and speak about my work. So a little bit about our farm, because I want to give you a little bit of context to how it is that we then partner with the community on some different programming, both that are equitable, and then also I'm going to be getting to the COVID-19 response really quickly. One thing I do want to say is that it's our employees that help us so much on the farm. It's not just me, Nathan, and our children. We have several employees And we hire people that are professionals and know what they're doing, especially when it comes to bookkeeping, decorating, marketing. It's so important that we are willing to reach out and get the right group of people around us who also understand our work and support it. So 50% of our income comes from 10 households. A lot of people are kind of surprised by that, and that's very intentional. Those 10 households come to the farm on Thursday, and they can take all the beef, pork, chicken, milk, eggs, and fruits and vegetables that they can eat for the week. Those 10 households say that at least 50% of their plate is fruits and vegetables, and many of them have health conditions or health concerns, which is the motivating factor for joining our farm in that way. I wanted to show you really quick what it looks like for those, for them to be, what it looks like for them to come and pick up on the farm. So this is one of our farm members, Megan, and her two daughters. Her youngest daughter has Crohn's disease, and that's one of the main motivating factors for her wanting to eat more fresh food. This is a picture of them visiting the farm, picking up their food, heading home, getting home and then loading their food, and then Megan cooking that food with her daughters. This is a big part of why we do what we do. But in addition to that, doing this has allowed us to have a diversity of product, because 52 weeks of the year our farm members come here to get food, and we have to be growing a wide variety of fruits and vegetables. We have to have enough carbohydrates. We want to have lots of greens. We want to have a lot of variety. What that has also done is it has allowed us to have a lot of diversity of product and variety at Community Farmers Market for our sales, and that's been really, really important to our work there. Another thing that's very important about the work we do at Community Farmers Market is accepting, like I said, the WIC, the senior, the SNAP, Big Red Dollars, which is for WKU students, and then providing those double dollars that are in partnership with the Community Farm Alliance. It's been a really great way for us to be able to do that and make sure that we're being equitable. In addition to that, the Fresh RX for Moms program is new. We're actually getting ready this week to launch a new program that's going to run 3 years. Expected moms to be on Medicaid can get $20 in fresh fruits and vegetables every week at the farmers market up to 40 weeks of their pregnancy and postpartum. In addition to that, we have an on-farm or a farmers market registered dietitian, Amanda, who provides, once we're able to, sampling at the market, but she provides recipes, nutritional information. And so not only are they coming and getting the food, but they can have that connection with both the farmers and a registered dietitian. A big part of what we've done at Community Farmers Market is we've mentored farmers, beginning farmers that want to learn more about farming. They come here on the farm and work for, this is Max and Davita. They were on the farm for about a year, but we've had people on the farm mentoring for several years. And this allows us to keep encouraging people to farm. But the biggest priority for us is we want people to have land ownership. We want them to get access to their own land so that they can really invest in the crops that they're going to grow and in the future of Kentucky farms. Next, I'm going to be talking a little bit about the Farm to School program. And I want to start with a lesson learned, because a lot of what we do on the farm actually comes from the lessons learned. We put in an on-farm certified kitchen in 2015. And with that kitchen, we had planned with a value-added promotion program grant to process butternut squashes into a puree that the school systems would be able to purchase. But from the time we applied for that grant to the time we found out we received it and then we had access to the funding, the school systems had changed the value of the puree butternut squash became a half vegetable. And what that meant was it really wasn't going to be affordable to be able to do that. And so with that kitchen, we had to ask ourselves, what else could we be doing? And so we started doing taste testings in both the Bowling Green City schools and the Allen County Scottsville schools. An important piece of this is that the kids are taste testing these fruits and vegetables that are grown in the winter months when school systems are in and when Kentuckian farmers can be growing lots of really nutritious root crops and different kinds of greens. They taste test 16 different kinds of greens and root crops, and then we survey each student. We ask them, did you like it? Would you try it again? And having these survey results help us know which fruits and vegetables the kids would like to see in the cafeteria. This is the Allen County chat group, and they were at the Foundation for a Healthy Kentucky's event last year. From left to right, there's Brittany Fisher with Dugas Park, Scott Williams with the Allen County Health Department, Nancy Monroe with Extension, Robin Harrington with the Allen County Scottsville Schools Food Service Director, and Carolyn Ritchie, who's a nurse at the Allen County Health Department. What we were doing at the Foundation event last year is we were talking about how all of us work together and partner to encourage people in Allen County to eat fresh, healthy food. It is so important that when we're trying to send this message to young people or people who are lower income, that they're hearing the message consistently and time again from different people. And so by working together with all of these partners, we're able to do that. This is a plate of food from the Foundation's event last year, and I have to say, probably the most important thing that I do as a farmer is I try to encourage us to put our money where our mouth is. And what I mean is when we're having meetings and conversations about fresh food, we should be eating fresh food at those events. The more we can experience real food while we're talking about how to get Kentuckians to eat better, to eat more fresh food, is to really experience it and do it. So with that, we started talking first with Allen County schools about how can we really help the kids that are getting these snacks in the classroom really connect to the experience. And the way to do that is to get kids on farm. We started with Allen County high school freshmen who would come to the farm and spend about a half day. They would work on the farm doing different activities, and then we would share a meal together. And that has been such a great experience. We've had students since then want to come work on the farm, and also we have more and more of these students asking about farming for a living. So soon after Allen County started coming, the Bowling Green City Schools and I started talking about how can we get urban kids to the farm? How can we get them to come to the farm and see where that kale or those Brussels sprouts or that celery that they had tried in the classroom was actually grown? And so we started inviting them out to the farm. So we have about 1,500 to 2,000 students that will visit. They will come, they will see the farm, they will touch things. Nathan will show them and teach them about how that food is grown. And then we always do another taste testing, which is always important for the kids to actually eat the vegetables that we're talking about so they can actually experience it, to think about more than just how this tastes, but think about what it means. Think about what it means to be eating this food for yourself, for your nutrition, for your health, but also to be supporting Kentucky agriculture and local economies. And they learn about farming, they learn about us. This is an example where I said, who here knows who your farmer is? And all the kids raised their hand. They learned that we were their farmers. And then we have a little market for the students so that they can take some of the fruits and vegetables home with them and share them with their family or their caregivers. It's important to us that we keep making that connection over and over again. But one of the things that happened while these students were coming and they were getting this experience with fresh food and they were learning that we were their farmers is we realized that there was a little bit of a disconnect, because while they thought that we were their farmers and we looked like farmers, they weren't quite sure that they could be farmers. So last year we started partnering with Ashley and Trevor from Black Soils. And what Ashley and Trevor are doing is they're providing education across the state about the rich history of Black farmers. And what they're able to do for us on the farm is they're able to help the students, the urban students that visit us on our rural farm. They were able to let them see that they too could be farmers. Our partnership with Hotel Inc., which is a local food pantry that also provides services to the homeless, housing, and other resources, started with weekly deliveries of fresh food. We've been doing that for 6 years now. But we wanted to take it a little bit further. We wanted to figure out how can we help people when they come to the food pantry decide that they want to pick fresh fruits and vegetables to take home, and also how can we help them to eat those fruits and vegetables once they get them home. One of the ways we did that were taste testings right there on site. Of course, this was pre-COVID-19. But the experience of them seeing, this is my daughter Lila, simply sauteing squash and zucchini with a little bit of olive oil, and then taste how delicious it is and have that connection was a great way to increase the amount of fruits and vegetables they were taking. But the lesson learned was that as we started having conversations with people, and as Hotel Inc. started having roundtable discussions with people in the community and chronically hungry people who were using the food pantry month after month, we discovered that many of them would be able to actually pay for food if they had the access to it. So last year, we piloted a pay-what-you-can co-op for people in the community and people that were participating in the food pantry with huge success. We found that it was more about the access oftentimes, or the connection, or the support, and the relationships that really were what was the barrier to fresh food. And with that, I want to say we have been so fortunate to have so many young people that want to come around our farm and provide that relational, emotional labor, that relationship with the consumers to help them with that connection to the food. Now for our COVID-19 response. I really wanted to start and make sure I went through kind of how we got to where we are now. Because I do want to remind people that Nathan and I have been in this work for 20 years, and we've been farming full-time for 7, and we've been doing this very focused work for 5. And so we all had our starting place. But it was because of the partnerships and the groundwork that we already had that when COVID-19 happened, we were able to immediately get to work making sure that people that were in a crisis were able to get access to food, and also to help people who were being diagnosed with COVID-19 to make sure they were getting access to fresh, healthy food. Our friend Susan Worrell, who's the market manager at Community Farmers Market, did an excellent job making sure that we stayed open, we didn't miss a beat. The safety was a priority at the market. The 6 feet spacing, hand washing, wearing masks, making sure that our vendors had access to masks, and then also curbside pickup. People could order, and they still can, directly through farmers and vendors, and be able to pull up and get that curbside pickup right there at the farmers market. We want to thank Susan for the extra work she put in, because it was a lot of extra work, and continues to be, as weekly and monthly changes are consistently happening with that. During the crisis of COVID-19, my son, who is 16 years old, Carter, became a full-time farmer. He decided that he has decided he wants to be a full-time farmer, and this is him set up at the farmer's market on his first day selling his fresh fruits and vegetables. I want to mention that probably the most important thing that we did in response to COVID-19 was prioritizing live sales at Community Farmers Market. We had worked for a long time to build up WIC, Senior, SNAP, the Fresh RX for Moms program, and so on. And it was so important to us that those participants could come to the farmers market and still have access to fresh food. So often, the food system work that we do for the lower income members of our communities is the first to go, especially when we're talking about them coming and using their supplemental nutrition program dollars. And what that often does is it then makes them dependent on food pantries, which then turns a crisis situation into a chronic situation. So what we wanted to do is we wanted to make sure that all of the efforts that we had put into building a better food system were there, and they kept going, and they built stronger. Another thing that we've done is the PEBT cards that have been distributed through the school systems. People can come to the farmers market and get access to fresh fruits and vegetables with those benefits. My friend Jenny Williams in Hazard, Kentucky, so in eastern Kentucky, has done several of these same things to make sure that the fresh stock market that she's a part of continued going, and we're really proud of the work that she's been doing. In Allen County, because of our partnership with the Allen County Health Department, we were able to, in the beginning especially, send fresh fruits, vegetables, and other locally grown foods to COVID-19 positive community members. This was important to our farm because we wanted people to know that even though you've been diagnosed with COVID-19, you are wanted in this community. You are special to us. We love you and we care about you, and you deserve access to fresh food so that you can recover as quickly as possible. The school systems, both in Bowling Green and in Allen County, immediately took to the emergency feeding programs, and we are so proud of the work that they did. And we're also thankful that they allowed us to connect with them and partner with them to make sure that we were getting the fresh fruits and vegetables that we had grown for those school projects out to the students. And that was just such an important part of our work to make sure that got to keep happening, and kids kept seeing, again, that fresh fruits and vegetables over and over again. I love this next picture. This was sent to us on Facebook from a student in Allen County, Scottsville. Here she is, the first week of school. She's home, isn't sure when she's going to get to go back to school, and in her daily delivery of food from the school system was that pack of fresh fruits and vegetables that she had gotten in the classroom before, had seen before, and now she gets to try it at home. Another partnership that we have is with the Bowling Green Medical Center, especially with Dennis Cheney and Sarah Widener. We had just met with them and were talking about ways that we could connect on fresh food, and then COVID-19 happened. And at first we weren't really sure how that might move forward, but Sarah and I kept talking about how we could really help people eat fresh food. And the reality is that some people, let's say they have COVID-19, or let's say they have limited resources, or housing is an issue. Some people just don't have the capacity to buy whole fresh fruits and vegetables and process them. And so we started thinking about providing medically tailored meals, and a meal that really takes all of the decision-making out of the equation, where people can really just focus on eating well. And so what we did is we partnered again with Hotel Inc., who already had the partnership and the connection and the resources to be able to do distribution in a safe way to people in the community who are either medically fragile, lower income, or positive with COVID-19. And they got access to these fresh, medically tailored meals that were delivered to them. And I can't help but think about the excitement and happiness people have had over these meals. And it's also been one of those things that we've realized that this is very likely the direction that our farm will continue moving with some of the work that we do. Other people across the state that are doing really good work, Becca Self with Food Chain, they just hit 100,000 meals served to people who need access to food. So proud of the work that they're doing. They're in Lexington. Also, Lindy Huffman with the Kentucky Women in Ag program and their annual conference does such a great job at connecting women across the state that are doing work like I do. And here they are in the Kane Kitchen. This year's conference has been postponed to next year, but it's going to be in Eastern Kentucky, and I would encourage people to consider attending that. Another piece of the work that we did is we wanted to really make sure that the food that we had and that we were able to distribute went to people who really needed it. And our friends in West Louisville had reached out about their need for access to fresh food. The grocery store, local grocery store, had shut down during the protests and also during COVID-19 for a short period of time. Plus, they already had limited access to fresh food. And what we were able to do is we were able to deliver food to them. And people, I think we delivered about 150 bags of fresh food. And people who needed that food because of the need for food access received it, but also the community leaders who had been dreaming about a local grocery store that buys from Kentucky farmers for years, that I've been supporting and working alongside, they also got fresh food. I wanted to motivate and encourage them to see and feel and taste that food and realize that that hope and dream that they have had for all these years is possible. And my friend Casa Heron, who is president of the Louisville Community Grocery Store, was one of those people. And she has inspired me for years with her passion and her drive and her commitment to getting a grocery store right there in her community. And recently, in the last couple of weeks, they have been committed $3.5 million by the city of Louisville to make that happen. And that right there is hope to me. That is hope in action. Another partnership that we've had that has come out of COVID-19 just recently, this last week, is the Boys and Girls Club in Bowling Green contacted us and said that they were delivering 200 bags of food to students that were kind of needed that connection, needed somebody checking on them, needed that access to fresh food, and wanted to know if we would be willing to keep doing the fruit and vegetable snacks for them. And so as you can see here, this was the example of the squash and zucchini that they received last week. They also received that educational material that reminds them of why this food's important, how it makes us healthier, some facts from the farm, and then also some games and activities. We're excited to see where programs like that have been started by COVID-19, how they may continue in the future. And I'm going to get close to the end now, but I wanted to wrap this up with a story about this young girl. On our farm, we do a lot of activities such as farm schools and farm to school, different kinds of events, and for the community. And we like to offer scholarships to students who are part of the summer feeding program. And this was a little girl that came to the farm. And there at the farm, she had received a gift. She got to pick vegetables for the first time. Here's her little pile of tomatoes. She got to swim in the creek. She got to run through the fields. And she lives in an urban area, so she was unable to have that experience before. And at the end of the day, she said to me, "I will never forget this for the rest of my life." And I have to admit, I believed her. I knew that she had had that experience and that it was going to mean something to her, that it was going to build that resiliency. And I think there's part of this little girl in all of us. We all want to figure out how we can build that resiliency in our life. My good friend Carolyn Ritchie from the Allen County Health Department says, we may never know the full effects of our work. It may take 20 years before we know that the work that we're doing matters in someone's life, but we keep doing it. And as my husband says, we do this work because it's the right thing to do. So what I'd like to do is I'd like to give you some homework. And I've got 3 different suggestions on some things that you might try in your community. One of them is try to get fresh food at the next event that you participate in. If you're having an event on farm, if you're having a meeting, if you're having a social distanced picnic meeting, if you're hosting a work group, consider trying to reach out to farmers and get access to fresh fruits and vegetables and to make that plate of food as healthy as possible. I think that really speaks loudly to the real future of making this work happen. The second thing I would like to do is I would like you to do is consider to reach out to one person outside of your circle. So not somebody that's in the same job as you. So let's say you're a farmer or a dietitian or a nurse or you work for an insurance company. So not somebody that does that, somebody that does something else. And reach out to them and think of some small project or some activity that you could do together to build on this. Just brainstorm, get creative. If you're struggling with who you might reach out to, please contact Rochelle or I. What we would like to do is we noticed that there are a lot of people on this call, several farmers, plus several public health or other professionals or other community leaders on this call. And what we can do is we can help connect you all to one another. We can help you know who else is out there wanting to do this work. I encourage you to keep the project small. So all of the projects that we have done always start out very small with a very small budget or no budget at all, so that we can make sure that it's going to work. And we're always very careful about scaling anything that we do up, because what we have seen so often is if you scale up too quickly, then you start to lose part of what really makes this work happen. Remember that it's about the relationships, that the relationships are what really connect us to making better decisions about what we eat, and also about making sure that the work that we do is equitable and in support of other people. So that is the end of my discussion, but I would like to open it up to questions for the next few minutes.
Thanks, Michelle. We have some great questions in the chat. So here's one that came through when you were talking about your recent Louisville food distribution. Were you able to ask any CSA programs that had extra food?
Let's see. Were you able to ask any CSA programs that had extra food? I'm assuming that this means were we able to work with other farmers? Yes. So in response to the all of the food distribution that we do, I would say about 80% of the food that we distribute comes from our farm, and about 20% comes from other farmers. So it comes from other farmers. So when we were in West Louisville, it came from farmers in or around Louisville that we partnered with. Here locally, we partner with about 22 different farms in our community, both to supplement what we have in our CSA, particularly milk, cheese, things like that, and also the additional fruits and vegetables or items we need when we're doing those medically tailored meals.
Great. It looks like we have time for two more questions. I think you mentioned one, any farm-to-hospital plan in Kentucky.
So, yes, I would love to see more with farm-to-hospital, and I think that we are on the way. What we've been doing now is working with Sarah Widener, who's the registered dietitian at the medical center in Bowling Green, and she is helping us make sure that we are meeting the nutritional requirements for our medically tailored meals. But also we're working, the distribution at the time is going through Hotel Inc., simply because they have a home delivery program already in place. I would love to see more farm-to-hospital partnerships happen, and I honestly believe that post-COVID-19, discussions on how we remain low risk, how we lower obesity, diabetes, and cardiovascular disease will be a huge part of that conversation.
Thanks, Michelle. And you mentioned it again. Can you give us a brief description for people like me who don't know about Hotel Inc., what it's doing there in your community?
Yes. So Hotel Inc. is an organization that provides resources for housing. They have a street medicine program for the homeless, but they also have a food pantry. And in that food pantry, they have committed to giving as much fresh fruits and vegetables and other products that are grown in Kentucky to people that are using the food pantry, and are also our partners on figuring out how we can get fresh food access on the west side of Bowling Green to more people that are willing to pay but just need to have easier access.
Excellent. And you did describe a couple examples of how you do community needs assessment in relation to food. If you could give us some ideas on community needs assessment for food.
Yeah, so to be honest, like the best way that we have found is to survey. So like, for example, surveying students directly while they're eating a vegetable and asking if they liked it or not. Having roundtable discussions at Hotel Inc., where participants can tell us how we think the programs are going. But using those surveys and getting information, we do that also at Community Farmers Market for the Fresh RX participants, for example. But at the same time, I also think having that relationship, not scaling what you're doing so large that you don't know people by name and that you're not having regular conversations with them while they're picking up their food or it's being distributed.
Michelle, thanks so much for joining us today. As many of you might have seen, this series I've subtitled Kentucky Inspired. And a number of years ago, when I'm planning Health for a Change, I thought I have had the opportunity to meet such great people across Kentucky that have been working for decades to make improvement in the state of Kentucky around health. They could be working on health policy. They could be working, as Michelle does, on community farming, or their health department people. And I just really wanted to have this time to talk with them, to learn about what they're doing, to learn about their history. And I knew it would be beneficial to me, and I'm thankful for all of you who called in to listen today. And Michelle, you described it perfectly. It's about thinking about hope. And so I think the title Kentucky Inspired is appropriate for me. You gave me a lot of hope. I had my line on mute, but I was laughing and nodding in support, and your pictures brought me joy. There's a lot of homework to do and things I can do in my own personal life and my connections to make this happen for Kentucky. So thank you very much. I'm honored that you joined us here today on our webinar. Thank you for your time, Michelle. I'll send a bunch of links.
Thank you so much for having me.
Great. I'll send a bunch of links in the follow-up email to all of our participants today. There's a brief survey. Tell us what you want to know in this webinar, what you thought of today's webinar. I'll send the links that Michelle mentioned, both to her farm, Need More Acres Farm, and other links to follow up. Again, I'm Rochelle Seeger. I'm very honored to work here at the Foundation for Healthy Kentucky as Community Health Research Officer. This Health for a Change series is for you. I welcome your ideas and recommendations on what we can have for future topics. This is all about health and making partnerships across the state of Kentucky so that all of us can have access to, as Michelle shared with us, healthy fruits and vegetables and food from our Kentucky communities, and can get information about improving health across Kentucky. Michelle, we have 1 more minute left, and I would love for you to send us out with a final message.
Yeah, I would just like to send everybody out with the message that we need more Kentucky farmers. What I'd love for everybody to do is think about ways that you can start thinking about farming as a great occupation, a great way of life, a great way to make income, a great way to serve your community. I think if we as Kentuckians can shift our perspective on farming as a quality, great way of life, that we're going to see more younger people consider farming, so that when things like COVID-19 happen, we really can continue having access to fresh food and feed our own communities.
Thank you, Michelle. Thanks to everyone for being on our call today. Looking forward to healthy foods and connecting with you in the future. That concludes today's webinar.